Welcome to Healthy Hormone Chats. I'm Kasandra. I'm a Natural Nutrition Clinical Practitioner and Hormone Health Expert. I help active women in their 30s with painful periods inside my program, the Period Makeover Method. Today, I want to talk about a topic more women deserve real, empowering education on: the Fertility Awareness Method as a natural form of birth control. Most women are taught one of two things. You can get pregnant any day of your cycle, or your only real option is hormonal birth control. And neither of those statements is true. Here's a fact that blows women's mind. You can only get pregnant for about 5 to 7 days per menstrual cycle. Women are only fertile during this narrow window, while men are fertile every single day. This means your body is not constantly at risk of pregnancy. Instead, you have what's called a fertile window, and Fertility Awareness Method, often called FAM, is all about learning how to identify that window accurately, consistently, and confidently. So, what exactly is Fertility Awareness Method? At its core, FAM is the practice of understanding your body, your menstrual cycle, and your fertility patterns so you can either prevent pregnancy naturally or conceive consciously. It's not guessing, it's not an app telling you when you're fertile, it's you learning your actual signs of fertility each month. This method focuses on determining when and if you're ovulating. Ovulation is the main event of your cycle, and it's really the only time you can become pregnant. So here's a breakdown. Sperm can live up to 5 days in fertile cervical mucus. Your egg lives for 24 to 36 hours after ovulation, and that gives you a total fertile window about 5 to 7 days. Once ovulation has been confirmed, you can no longer get pregnant that cycle. So, how do you actually track ovulation using FAM? FAM involves observing three main fertility signs. The first one being cervical mucus, also called vaginal discharge. You can check the consistency and sensation, and this is the earliest sign and most reliable sign of approaching ovulation. Second, we have basal body temperature, also called BBT, and this is your resting temperature measured first thing in the morning. After ovulation, progesterone rises, which causes your temperature to increase. This shift helps you confirm that ovulation has occurred. And then the third one is additional ovulation symptoms. So these can include breast tenderness, increased libido, mid-cycle pain, and changes in mood or energy. So tracking these together can give you a clear picture of your fertile window. Lots of people ask, how effective is fertility awareness method? So when used correctly, the fertility awareness method is 77% to 98% effective, depending on whether you're using it casually or with perfect use and real training. So that's similar to condoms, and in some cases as effective as hormonal birth control without synthetic hormones, side effects, or guessing. The American College of Obstetricians and Gynecologists even states fertility awareness is knowing and recognizing when the fertile time occurs in the menstrual cycle. And they emphasize that if you're using FAM to avoid pregnancy, you either abstain or use a barrier method during your fertile window. And if you're trying to conceive, that's when you intentionally time intercourse. Why more women are turning to FAM? Because it gives you body literacy, a natural hormone-free birth control option. It can help you deepen your understanding of your health, and you're more connected to your cycle. And it puts you in control of your fertility, not a pill, not an app, and not guesswork. So if you want to start understanding your cycle more deeply, especially if you struggle with painful periods, you can download my free guide, 5 Easy Ways to Reduce Painful Periods Naturally Without Hormonal Birth Control. The link is below in the description, and it's the perfect next step to learning how your cycle actually works and how you can support it. So thank you for watching, and I'll see you in my next video.